Infrastructure, industrialization, and innovation are society's pillars of success and strength. Without them, we cannot function properly. Basic infrastructure is required for society to function properly and is lacking in many communities and developing countries. This can vary from roads and communication to sanitation, electricity, and water. About 2.5 billion people lack basic sanitation worldwide, and 800 million are short of water. This SDG is one of the most expensive ones since it is basically building communities with all of their needs. However, this can and will be accomplished if we work together as a community to help those that are in need. This SDG focuses on building resilient infrastructure, promoting inclusive and sustainable industrialization, and fostering innovation. The issue at hand is to help improve the situation in less economically developed countries or simply LEDCs through innovation and urbanization. But what is an LEDC and what is urbanization? Countries that are claimed to be LEDCs are relatively poor countries. And what defines if a country is poor or not? Some of the factors for this include high birth rates and death rates, lower life expectancy, lower standard of living, and low literacy rates. Examples of LEDCs are Kenya, Nigeria, and Uganda. Urbanization, on the other hand, is defined as a process by which a large number of people become permanently concentrated in relatively small areas, that is, by forming cities. Statistical data from the UNESCO Institute of Statistics shows that primary school-age children out of school in LEDCs make up 76% of the world's out-of-school primary school-age children. As of 2016, the average birth rate in sub-Saharan African countries is approximately 36.3 per 1,000 people compared to 12.25 per 1,000 people in North America. As of 2015, the life expectancy at birth in sub-Saharan Africa is approximately 60 years, while that of the entire world is approximately 72 years. Coming to the issue of LEDCs. Numerous countries under the LEDCs list are in reality former colonies, weakened by lack of industrial development. Approximately 70% of the nations in the LEDC list, according to the United Nations, are a part of the African continent. Many of the LEDCs were left without proper economic and social infrastructure after the foundation of independence. Many of the inhabitants of the LEDCs were living under the poverty line due to lack of a strong economy and the investment to LEDCs. LEDCs were facing quite a number of problems while they were dealing with poverty. Infectious diseases and epidemics on a mass scale were affecting a majority of the LEDCs, especially those situated in sub-Saharan Africa. Along with the geographical aspects, another factor that allowed these diseases to affect such a large scale of the population was the fact that citizens of LEDCs had access to little to no healthcare at all, since the governments experienced lack of financial power to invest on healthcare. According to the data from the UNDP, that is, the United Nations Development Programme, in 2000 there were an alarming 3.5 million new infections of the HIV virus per year. Exploitation of resources. Pressure on resources due to overpopulation reduces the quality of life in an LEDC. However, according to the World Bank, the primary reason for the poor conditions in these countries is the overexploitation of the country's resources by a more economically developed country or simply an MEDC. Most of the LEDCs are the countries that are involved in producing raw materials for different products around the world. MEDCs purchase cheap raw materials and use those raw materials to exploit the civilians of a poor country by making them work tirelessly and providing them with a meager income. The MDGs and the SDGs. Millennium Development Goals, or the MDGs, were created under the UN in 2000. The MDGs were created to lead the development efforts. They were also directed towards the LEDCs as they were in urgent need of global aid to help in a variety of areas, from the eradication of poverty to combating threats to public health such as HIV. The UN declared the successor of the MDG initiative in 2015, what we now know as the SDGs, or the Sustainable Development Goals. These were the next step towards achieving developments in a variety of fields in a global scale. The SDG has bold promises for LEDCs to be achieved by 2030, such as, but not limited to, the complete eradication of poverty and hunger, access to quality education for all, proper infrastructure, and gender equality. In African cities, infrastructure, industrial, and commercial structures have not kept pace with concentration of people, nor have investments in affordable formal housing. And because of this lack of connection, African cities are among the costliest in the world, both for business and for households, leaving cities out of service and closed for business. African cities are 29% more expensive than cities in countries at similar income levels. African households face higher costs relative to their per capita GDP than do households in other regions, much of it accounted for by housing, which costs them a full 55% more than in other regions. In Dar es Salaam, for example, 28% of residents live at least 3 to a room, in Abidjan, 50%, and in Lagos, Nigeria, 2 out of 3 people live in slums. Adding to this, city dwellers pay around 35% more for food in Africa than in low income and middle income countries elsewhere. Overall, urban households pay 20 to 31% more for goods and services in African countries than in other developing countries at similar income levels.